this next question we've kind of talked a little bit about throughout our conversation, but I guess is a little bit more directed towards the adolescent and adult patients with SMA. So, what are factors that guide decision making when determining treatment and which treatment for adults and adolescents with SMA? So, talk a little bit about some of the factors that guide decision making for these patients specifically.
Yeah, in general, I think we have a much easier life in the adult clinics than because usually the patients are well informed and they have a good idea of what is going to work best for them. And I think two things come up on the top. One is really is quality of life and functional independence as one of the primary consideration. And the other one is really burden versus benefit. There is financial burden for when people need to take off to come up for those visits or assessments visits. There are burden also on other family members. There are logistical things in terms related to transport. There is emotional things related to the treatments and the expectation of response to the treatments. And so the healthcare provider working group, which had 18 members from between Europe and the US, listed several important points. There are nine of them, and I mentioned multiple that should be discussed in the clinic with patients, including also reproductive issues, including the patient perspective, as I started with, and the progression of symptoms despite treatment. And so, clear expectation, clear game plan ahead, and seeing what really going to works best for their schedule and their commitment, and that will help with the decision making.
Yeah, I think some examples of that, for example, might be, if someone is on intrathecal administration, for example, is that easier than having to think about a daily, remembering daily medication, or if they're traveling or things like that, is that easier to say, well, I get this every 4 months, and this is easier in terms of kind of, from a life perspective. Whereas maybe some families or some of the teenagers may say, well, it's missed school, and then I potentially am home on the day of the lumbar administration of the therapy, and then potentially if there's any headaches that occur after, am I home the next day? So I think sometimes there are nuanced things. How does that play into the life of that individual and what they're doing in their day-to-day life? Does that lead to missed work, missed school? Is it is one easier than the other? Is one better tolerated than the other? So again, we take, as Bakri said, we really take all of this into consideration when we think about quality of life, not only what is gained in quality of life by treatment, but also how does taking this therapy as a whole impact, and hopefully not negatively impact too much, the burden of treatment on their day-to-day routines and life.
And then there are also, as another thing to add, is really the real world challenges, right? So there are the real world challenges. And so one of the major barriers that identified by the group is access to treatment, which include insurance and payers. And in some cases, in some countries, it is the national clinical criteria, and that define what medication is used in certain patient population. And so some of the patients might have access to one treatment versus the other. Not only their medical complexities that might make one treatment, for instance, an oral or enteral, more easier than pursuing an intrathecal route.
Yeah. And I know sometimes for adolescents, for example, as they're transitioning to the college years and maybe leaving home. And I know we've had discussions with families as well about what does that look like, especially if they're on intrathecal therapy. Where are they going to be for their college education? Are they going to be close to a site? Will they get dosed where they're at college? Will they do that when they come home? So these are at least discussions over the years we've had with families and thinking about not necessarily switching medication. If they want to stay on a medication they feel they've been on, they tolerate well, has done well for them in terms of their symptom benefit. Sometimes there are also just logistics about figuring out how do you make sure that you're supporting the family and that young man or woman as they're going on into the next stage of their education, for example, but might need to alter their treatment plan or and that care plan as well.